We should be going live at last. So I'm going to, yes, we are live. So that took us a while. Thank you for anybody who joined us at 12:15 on the mark. It took us 5 extra minutes to make this happen, but this is something that I've been excited to do for a very long time, Matt, is to, as always, I mean, I love and chatting with you, working with you in any way. But I think share your story and your insights with the world is even bigger. So first of all, if for folks that might be joining us live, my name is Julie Hershberg, and I am a neurologic physical therapist, the owner and founder of Re+active Therapy and Wellness. And every now and then I get a chance to interview one of the amazing people that have been working with our team. And I've had the great privilege to also be able to work with Matt. So I feel extra lucky today. And Matt, I has been participating in our integrated program, which for people post-stroke, and it's a program of physical therapy and occupational therapy and psychology to support the whole person in their recovery. And I know from interacting with Matt that this has been a really different experience than you've been through a lot of therapy. So
Sure.
this is different. And so Matt, I thought first, people always want to know you, like, what's your story? Why are you even doing this? So I'm wondering if you can tell a little bit of your story,
Sure.
and why you're going through neuro rehab to start out with.
Sure. Yeah. So I had a CVA, like hemorrhagic stroke, in the brainstem in the pons about 5.5 years ago, April 2017. I was in acute rehab and then inpatient rehab and then outpatient for 3.5 years after that. And a couple of years ago, I started doing outpatient with Re+active. And then I just started about 2 months ago the integrated program because I felt like my recovery process needed that sort of like extra kick in this phase. So yeah.
Yeah, that's great. The extra kick. And I know because you've done a lot of physical therapy with us. You've done occupational therapy. You are kind of a connoisseur of rehab. I would say you have taken advantage of so many great programs, and I actually think that's one of your greatest strengths is just advocating and asking for what you need and just not giving up. You're like, there is more because you've seen these glimpses and changes and improvements over time. um what what led you, I know you said the extra kick, but why an integrated program with the addition of psychology,
Yeah.
particularly because you had
Yeah.
had PT and OT, and also that it's a higher intensity, right? So you're
Sure.
having a lot of therapy at once. So I wonder why that.
Yeah. So I've had OT and PT, but not like this. It's
Mm.
OT-PT plus when you're in an integrated program because along with psychology. So my team is Natalie Thomas, Jenna Manjali, and Dr. Brandon Seaman. And what they are doing is they're looking at the whole organism. They're taking the aperture and racking focus way out. So they're looking at what are your challenges globally, not just can we get your arm to move a few degrees more, right? And so I think that is a worthy goal. Don't get me wrong, to move the arm a couple of degrees, but in an integrated program, you spend the time to look at the whole organism. So in my case, I had just been like the thing that caused my CVA is called the cavernous malformation. There are two types of angiomas: the ones that bleed once and that's it, and the ones that bleed and bleed and bleed. And so I had one of the second ones. And in that case, the recommendation is a surgical intervention. So that's what I'm looking at. And I was freaking out about that, losing sleep, literally, and kind of obsessive. Also, my amygdala was impacted by my first CVA and subsequent CVA. So I have a kind of elevated fear response. Anyway, at baseline. And so, or my new baseline. So, so the whole team said, okay, how can we address these challenges that Matthew is facing in terms of sleep? Because we know sleep affects his brain's ability to change and grow and heal. So before we even look at the healing, let's look at the sleep. Let's look at these things that are front of mind. How can we give Matthew tools to battle that fear response? Battle is the wrong word, to cope with that fear response. And so that's what the integrated program did. I can't tell you, like I guess I can. I'm sleeping a full night now. I am confident about my surgery. In fact, I'm almost at times looking forward to it, because the surgery would take my chances of bleeding again from what they are now to 0. So having that perspective, right? Of course, the response is to say, I don't want surgery, but having the different perspective of that I have garnered from the program, and they didn't tell me you have to think this way. They led me to a personal discovery. And that wasn't just psychology, although psychology played a big part, but it's also OT, it's also PT, and it's, sorry, I'm going on, but it's also psychology. They call it co-treatments, right? So it's your PT session will involve the psychologist. In my case, Dr. Seaman would engage in my session. So they would be both treating me, that's what co-treatment means. So, but they would both be treating me, and so it would be, how does Matthew's fear response prevent Matthew from balancing better or walking more smoothly, or whatever the task may be. And so it's really an advancement beyond what you normally would get in an OTPT situation, and nothing against that style of working, but this is an even more advanced way of working in my experience. So
Yeah. No, well, like, you really had me with saying that everybody kind of joined you or led you in a process of self-discovery.
yes,
That, so I'm always so amazed by your very profound insights, because I would have never even put those words on myself, to what we do. But I think you described it really well, and you described co-treats better than all of us can describe as well. So,
I just thought of, can I say one more thing?
yes.
I'll say one more thing. I don't mean to interrupt, but it's that this way of working allows you to generalize the tools faster and more effectively. So if you have the tools in multiple scenarios, then you can apply them to other life scenarios. But if you only have them in an OT session for an hour a week, that is going to be harder by nature to generalize. Does that make
Yeah.
sense? I mean, of
That
course.
makes a lot of sense. Well, and it brings me to kind of a broader question. You already talked, like, your sleep is better, your perspective on this upcoming surgery, which is for anybody very anxiety provoking. So
Sure.
the fact that you can feel like, hey, I've gained perspective here, I feel less anxious about it. So the sleep, the perspective, and kind of maybe emotional piece, what are some other things? And then you said this kind of generalized application to your life. What else have you noticed with
Okay,
this more
so
intense bout of therapy?
the biggest thing is this: 5 years of therapy starts to be monotonous for anybody, right? And
Yeah,
it's hard
yeah,
physical work. Your work, it's like it's labor. You're doing, I'm not comparing it to giving birth, but it's like you're kind of transforming into a new person, right? You're giving up your old person, you're becoming a new person. You're staying the same, obviously, but I mean physically, you're just working in a new way. So that takes work. And what this does is it you feel like you have backup. Like you've just called for backup and they've taken a while to get there, but they're there. And like I'm not doing this alone is the feeling that I
yeah,
got.
yeah,
I'm not doing this alone.
yeah.
I'm not living my life alone. And before, it's like I lived my life alone and I went to therapy, and I really look forward to therapy more than anything. But it didn't feel like that world was kind of like interacting with my life, and this is
Mm,
like, let's look at your life. So practically speaking, old goals became completely salient again. Like
mm,
I things that I had shelved, I'll think about that in 5 years. Suddenly I'm like, okay, I can do that. So practically what I did was, it took me about a year and a half, but I went from a wheelchair to a walker. And I've been on a walker for a long time. And a long time, like 3.5 years. So there's a part of me that's like, heck yeah, I'm gonna get beyond this walker, right? That's my goal functionally. But there's another part of me that's like, well, you've been on this walker for 3.5 years. Like this might not be it. This might be where you are. And this integrated kick gave me the confidence and the ability to say, you know what, I'm moving beyond this. And now I'm working I'm using a trekking pole, and I was able to take like a couple hundred steps with the trekking pole. So it's like, we're making gains, and yes, that's physical progress, right? That's
yeah,
healing. That's parts of my brain's finding new neural pathways, but it's also, there's a functional component, right? You're calming down your tremors. Your amygdala does, like, what do you call it? Is it there's a Brocae. You talk about this area of the brainstem, or maybe it's even the pons, that is affected by anxiety. And
mm,
so there's part of all my movement, right? The cerebellum ataxia, that is ramped up or ramped down by my anxiety.
mm,
So if I can calm my anxiety, I can walk better, I can walk faster, I can walk smoother. And that's
mhm.
ultimately the goal. Um, so yeah, I've seen a functional improvement in such a short, we're talking about 2 months, two
Right,
months, right? I mean,
right,
there's like, the other thing is like, everybody tells you it's going to take so long. And yes, it does take so long. Healing does happen over a long period of time, but this is 2 months. It happened very quick for me. So
right,
yeah.
right. So you're able to do some steps with less of a device. I actually saw a video of you swinging a baseball bat
Yeah.
without holding on to anything.
Yeah.
That was
Yeah.
like Natalie shared. We can share like wins
Yeah.
together in some of our groups. One of the things I love actually is each of our teams kind of has a channel to communicate in and share like look at this, listen to this, and it's one of the ways that like collaboration comes together. And I'm a part of your team on there, so it's really fun. I get to see
Yes.
those things. You're sleeping
Cool.
better, you're recognizing where some of your anxiety influences your symptoms and vice versa, so you're just, it sounds like overall managing that component better as well. Are there other things that you're doing now you weren't doing before the
Yeah,
8
so
months or the 8 weeks?
let's talk about the OT part of it all, right?
Yes, yes.
So like what Jenna has challenged me to do is to use my right arm in daily tasks more. So
Uh-huh.
I have gone from, let's take my morning routine in the bathroom, the shower, and then brushing my teeth, doing my hair, whatever. I have gone through not using my right arm at all to using my right arm, I would say 60% more in that.
Wow.
So like I'm brushing my teeth now with my right hand. I'm combing my hair with my right hand. I'm opening doors. I can now do like the screw top on my Nalgene I could do with my right hand. And it's just through, it's through the physical work, but it's also through this, um, I don't have the right way to say it, but it just is, there is a purpose neglect of your right side, right? Or
Mm,
like an incidental neglect of the right
yeah,
side.
yeah,
And I'm caring for that right side again by using it, right? The old adage of use it or lose it, right?
right,
So like the
right.
more I use it, it's almost like I'm remembering a skill, remembering, it's like a
Yeah,
memory, right? It's coming back to
yeah,
me. So uh yeah, big time improvement in the OT realm for sure. Yeah.
yeah.
And
That's
that includes cooking, that includes light housework. I vacuumed the other day. I can wash the floors, stuff like that. Stuff I just wasn't doing a couple months ago. Um,
wow.
yeah.
That's, well, I'm sure your mom,
Yeah.
your
Yeah.
roommate, your mom is thrilled. Like you're, it sounds like you've gained a lot of independence with those things.
Absolutely. Absolutely. I mean, I live with my mom. She is the best person ever. I don't mean to say thing, but like person ever.
Yeah.
And she's my freaking hero. And she's had to do a lot. Like in the beginning, she was freaking feeding me, and now to like be able to cook my own meals, like I don't know, it's extraordinary. So I think like you just need to, like I need to keep setting those goals. So because I'm proving to myself that I can still attain the goals, right? The goal phase is not over. The goal phase of a year or 2 years or whatever they say after stroke has been proven not accurate. The goal phase never ends. So yeah.
No, no. And I think that's, that you're preaching neuroplasticity, absolutely, and all the principles behind it, and what is possible for somebody after a stroke. And I think I've worked heavily in the realm of working with people post stroke. And sometimes after a few years, like you've gone through rehab, people can get discouraged, like this isn't going to get better. That is one of the reasons we wanted to have a more integrated and intensive program, because sometimes that long drawn out therapy, like you said, is tiring, but it also, you don't see some of those changes as quickly, right? And so I'm curious, what would you share with the people who might be feeling discouraged that
Absolutely.
they can't get better?
Absolutely. It's not you. You're not out of motivation.
Mm,
It's not the end of the line for you, right? It's the that the creative solution hasn't been presented yet, but it's
mm,
nothing that you're doing wrong. So if you're not seeing the results, switch it up. Like
Mm,
it is incredibly scary to switch it up. I know
yeah,
from experience it can be, but don't, I mean, it's so easy to say, so hard to do, but don't settle, right?
right,
It's like you're not showing them that you can get results. You're asking for help to get the results from other people, right?
right,
And they, so it's not your fault. Like the stroke happened, that's not your fault. It's not stress, it wasn't your fault. Like,
right.
and if your arm's not moving, it's also not your fault. Like there, and it's not the end of the road. There is
Mm,
more road for you, right?
mhm,
You will think about this differently in a year. You will feel about this differently in a year. And if you're hungry, you will be working on this differently in a year. Like this happened, this 2-month period happened to me after 5.5 years of therapy. Like I was quote unquote in a plateau, whatever that means.
mhm.
But that doesn't mean it's the end of the line. It just means it's time to get creative again. And what the integrated program does, to repeat myself, sorry, what the integrated program does is helps you look at the challenge of your disability differently. So your disability, you are still in there, and you're just living your life through the lens of this disability. And that lens might be smudgy. And if you take a new approach, you might be able to clean that lens and see the road of your recovery a little more clearly, to beat up a metaphor.
Yeah, yeah. No, I love that metaphor. And I think, we do have folks that maybe meet us and they're on the fence. Like, I'm not sure if I like is this program right for me? And you know what? It's not right for everybody, right? But if somebody was on the fence and they're coming to you to ask for your advice, what would you share with them about this
Yeah.
program?
Um, I can guarantee, well, I'm in no position to guarantee, but I can bet this program certainly won't take you back, right? It's not going to like rewind your progress. And the possibility is that you will see incredible results. So just try it. And if it doesn't work after a month, you can say, you know what? It turns out it's not for me. But in that month, in my experience, you will see a new way of working. And so if you're on the fence, take a chance and take it from somebody who's literally been to every game in town and knows that this is the major leagues. Like, no, they're not like this, like Re+active isn't the size of a big clinic, like with a hospital, but it's full of minds who have dedicated their lives and their intelligence to helping people just like you and me. And they're working for the benefit of our healing. So I take a chance on them. They're really good.
And you are a pro at rehab.
Yes.
You absolutely are. Now, one last question, because we always we send our videos out every week to a newsletter of healthcare providers and then to a newsletter of people with neurologic disorders to share stories like this and research and all kinds of things. What message would you have for a healthcare provider? So another PT or an
Yeah.
OT, what could they learn from your experience and bring to other people across the
Yeah.
world that they might be
Yeah.
working with?
So 3 things, and I'll be quick. The first one is whether or not we express it, we, the patients, are unbelievably grateful. You are the most important people in our lives, full stop. Without you, we would be hopeless in some cases, right? So that's number one. Number one is the gratitude factor. Number two, that being said, I have some notes, and the biggest one is B.F. Skinner talks about don't blame. B.F. Skinner was a scientist. He did a lot of experiments on pigeons. He said, don't blame the pigeon. It's never the pigeon's fault. So if you're trying to get the pigeon to do something and the pigeon's not doing it, it's never the pigeon's fault. So don't blame. It's never the fact that we don't have motivation or we're plateauing, but instead we just might not have the tools to get to that next place, you know? So don't give up on us, even if we seem like we might not have that extra oomph in one day. Does that make sense? I don't know if that makes any sense.
No, that's brilliant. Yeah.
And then
So
the third
I'm
one,
gonna no pigeons, no blaming the pigeons. I love it.
the third one is, and I think I referenced this, but having a stroke is at bottom an existential experience. So it's a very it's at bottom an emotional experience. And so that needs to be acknowledged from day one in as serious a way as the other components. Yes, the goal is to get us functional, right? And if you can still if you can help us find self-motivation, if you can help us find the feeling of independence, you're going to get better outcomes. And that includes psychology from day one, right? Like, even though psychology doesn't have the track record that medicine does yet, it may in 500 years, but doesn't yet, psychology is just as valid and needs to be incorporated into these situations. I hope that's clear. Those are
Yeah,
my
that
3
is
points.
that is absolutely clear, absolutely clear. And I think what a great summary of your story too, where we know we've worked with you from physical therapy. We've worked on that physical occupational side. And it was when we added in an intensive way all those pieces together with psychology that things really changed. And some people are really scared of psychology, like, oh no, I'm gonna like lay on the couch and tell my whole life story. And you know now too, because you've worked with the amazing Dr. Brandy, that that's not exactly
Amazing.
what it is, right?
That's right. That's right.
Yeah.
It is practical, right? It's not like telling about your father. It's like, here are psychological tools that you can use that are digestible, that you can use as emotional challenges arise, which they will, because being a disabled person, let's face it, is emotionally strenuous. So why not have that set of tools? Yeah.
Right, right. And I know you have an enormous set of tools. You're going into a big surgery coming up here. And the thing is, this is also not the end, right? Like we were talking earlier, like post surgery,
Yes.
in a hospital stay and rehab, we're going to probably do another bout of intensive
Yeah.
therapy,
Yes.
right? And
Yes.
I think
Yes.
that's the other thing, especially in something where we're still on a pathway of recovery. It might be more than one, or two.
Yeah.
It might be a couple times a year that these boosts
Yeah.
might be helpful, right?
Yeah. Because the evaluation is so much deeper when you do an integrated approach, right? So like, you're at different stages throughout the year, and an integrated program will key into where you're at way more specifically. So they'll find the ways to help you way more specifically if they have an ability to really dive deeply into that and evaluate you fully. I mean, yes, you will get a full evaluation in an OTPT situation, but this is just added. So yeah.
Yeah. Next level. Matthew, I am so thankful for you for your incredible insights, for yourself, for other folks who are disabled, for people after a stroke, for humans in general. I think I'm so thankful for what you've shared. I think it will really impact people. And so I thank you for sharing with me here live and in this recording as well. So I just want to say that from
Okay,
from the bottom of my
when we
heart.
just let's I just want to say it. I found Reactive through watching a YouTube video of you talk about ataxia, and I'm a huge fan of Julie Hershberg. And I just want to say, like, what you've done for us folks who are neuroatypical is unbelievably heartfelt, right? You're looking at us from all perspectives. And so, like, from the moment we come in the door, like the front desk is amazing, right? All the therapists are amazing. All the Zoom classes online are amazing. So everything has been like A plus, and so thank you. Thank you.
Thank you, Matthew. I am thoroughly red and embarrassed, so I appreciate that very, very much. And I think the feeling is mutual from our entire team to you as well. So all right, Matthew, thank you again for your time
Thank
today
you.
too.
Cool.
And I think we'll have to do this again
For sure.
sometime. I look
Anytime.
forward to
Anytime.
it. All right. Thanks, Matt.
Thank you. You too. Thank
Bye.
you. Bye. Take care.